Good afternoon, everyone, and welcome to the 18th Annual Howard L. Bost Memorial Health Policy Forum webinar. While everyone finishes signing on to today's webinar, please take a moment to use the question box at the very bottom of your screen to write how the pandemic has affected youth vaping and substance use in your opinion. While you write those comments in, we'll start in about 1 minute. Okay, we'll go ahead and get started now. Thank you so much. As I said, welcome to the 18th Annual Howard L. Bost Memorial Health Policy Forum, brought to you by the Foundation for a Healthy Kentucky in partnership this year with Kentucky Youth Advocates. I am Bonnie Hackbarth, Vice President for External Affairs at the Foundation, and I am delighted to moderate today's program. I'm serving in place of Eva Stone from Jefferson County Public Schools, who's been pulled into a meeting about coordinated COVID vaccines for JCPS staff, so we'll have to give her a break for that. The Foundation for a Healthy Kentucky is a nonprofit, nonpartisan 501c3 organization, and we have one overriding goal, and that is to improve the health of Kentuckians. Toward that end, we offer this forum free of charge. In memory of Howard L. Bost, it's designed to highlight programs and policies that, based on real-world evidence, actually result in improved health outcomes. The Bost Forum is an example of the Foundation's approach to policy advocacy. We bring together Kentucky residents, providers, educators, and policy leaders, among others, to learn about and lend their support for programs and policies that are proven to help Kentucky adopt, implement, and expand health improvement success stories. This approach is also behind the Kentucky Coalition for Healthy Children, now seeking additional member organizations. The Foundation is the backbone organization for this new coalition, which is working to identify and promote policies to improve children's health in the school setting. Learn more at KentuckyHealthyChildren.org. Now on to today's event. The title of this year's Bost Policy Forum is Moving Kids Towards Natural Highs, and we're focusing on programs and policies that help move Kentucky kids away from substance use, suicide, and other risky behaviors, and toward healthier behaviors that will benefit them throughout their lives. As I mentioned, our partner in this year's forum is Kentucky Youth Advocates, the Commonwealth's independent voice for kids. I know you join me in thanking them for their work to improve child well-being in the state. The title of today's webinar is Stopping Vaping and Substance Use. Our presenters are going to help us understand the current state of youth use of tobacco, alcohol, and other substances, including longer-term trends, as well as the specific impact of COVID-19 pandemic on those trends. We'll explore evidence-based programs regarding how to talk to youth about e-cigarettes and vaping. We'll learn about an effective youth substance use prevention program in Lexington, and we'll hear about one high school student's experience of becoming addicted to nicotine, how she finally quit vaping, and her subsequent advocacy work at the local, state, and national levels. Each of our 4 presenters will in turn speak for about 10 minutes, and then we'll open up the webinar for your questions. A couple of housekeeping items before we get started. All audience and speaker microphones are muted, and this helps reduce background noise. If you're posting on social media about this webinar, please use the hashtag #2020 Bost Forum. Please write your questions at any time during the webinar. You don't need to wait until the Q&A session at the end. Just type your question whenever you think of it in the box at the bottom of the webinar screen. And if you want an answer from a particular speaker, please note that person's name so I can direct that question appropriately. I'll try to get to every question during the live webinar, but if I don't get to yours, please know that we will capture your question and get a response to you after the webinar. Finally, these webinars are recorded and then posted on the Foundation for a Healthy Kentucky website. The link is on your screen right now, healthy-ky.org, and we'll show it again at the end of today's webinar. And now I'd like to introduce our first speaker. Abby Hefner is a junior at McCracken County High School in Paducah who has shared her story of becoming addicted to e-cigarettes to encourage policy changes that will reduce youth vaping. She's an active member of the Taking Down Tobacco Student Ambassador Program, and several of her peer ambassadors are with her today. Abby has told her story in Frankfurt, on television, through letters to the editor, in nationally aired videos, and even in a news conference with U.S. Speaker of the House Nancy Pelosi. She also performs positive peer teaching to students at her high school, as well as local elementary schools about the dangers of using e-cigarettes. And in October, Abby was named the Campaign for Tobacco-Free Kids an Individual Advocate of the Year. Abby, congratulations, and please go ahead with your presentation.
Thank you. Good afternoon. I'm so happy to have the opportunity to speak today and share with you some of the experiences my ambassador team and I have had over the past year with our fight against big tobacco. With me today, I have several of my Family, Career, and Community Leaders of America, or FCCLA, chapter members and student ambassadors. Abigail Berman, Mallory Stewart, Natalie Herring, Bailey Watts, and I have all been active in advocating for stricter laws to protect young people from the marketing tactics being used by e-cigarette companies to lure us to use vaping products. It's a trap. A brief history of the past several months shows that e-cigarette use among U.S. youth remains at epidemic levels. Several local city ordinances, state laws, and national legislation has been passed to strictly limit the sale of flavored e-cigarettes. We have seen positive results from these actions as there has been a slight decrease among high school students' e-cigarette use. The drop in youth e-cigarette use is driven by a number of factors, including new public education and cessation efforts, as well as the remarkable progress, particularly at the state and local level, that has been made in the last year prohibiting flavored e-cigarette use. There is still work to be done. It is estimated that 8,000 teens start vaping every day according to the American Lung Association, and 26.1% of Kentucky high school students and 17.3% of middle school students currently use e-cigarettes, which is higher than the national average. With those figures in mind, one reason tobacco companies are wanting new customers is that 8,900 people die in Kentucky each year due to smoking. While their lifelong customers are dying off, tobacco companies have to recruit new ones so they market to young people with slick, alluring ads showing people having fun and living life to the fullest. They don't show the ugly side of addiction, with people on their deathbed suffering from lung cancer and COPD. This leads to $1.9 billion in healthcare costs each year. Young people vaping is bad enough for health reasons, but coupled now with the pandemic, it makes it even worse. Dr. Albert Rizzo states that smoking and vaping are linked to lung inflammation and can increase the complications from COVID. The Cleveland Clinic reports that vaping can compromise the respiratory system and can impair the immune function of cells found in the lungs. Closer to home, I have friends that say it is harder to wear masks all the time because vaping makes it harder for them to breathe and exercise. With the mask, it makes it worse. With the new Tobacco 21 laws in place, one might wonder how teens get tobacco and nicotine products. The answer is older siblings and friends, stores that don't check IDs, and mail order. It is easy to order e-cigarettes online. A website cannot determine who is making an order. All you have to do is fill in a person's personal information who is over 21, which is easy to grab your mom's driver's license. It was great news when the latest COVID relief bill included a ban on mail shipments of electronic cigarette products and applied federal laws on cigarette sales to online sellers of e-cigarette products beginning March 1st. Our goals to reduce the occurrence of teens vaping are listed on this slide. You can see we focused our efforts in 4 areas: prevention, cessation, advocacy, and training. Over the past year, we have seen what works to combat the problem: education and advocacy. We have taught over 1,000 high school students and 500 elementary students on the dangers of e-cigarettes. We have met with state and national legislators about enforcing stricter laws against the sale of flavored tobacco products. What got us started with our Taking Down Tobacco program was our principal, Mr. Matthew Hauser, encouraged our local FCCLA chapter to confront the teenage vaping epidemic which was occurring in our local school. Over 40 students joined our ambassador team and received training of the Campaign for Tobacco-Free Kids through a teleconference. We took the peer-led approach and visited elementary schools, high school classrooms, sent a letter to the editor, and had assemblies campus-wide to encourage students to say no to vaping, stop vaping if they had started, and advocate for stricter laws. My advocacy efforts provided me with several audiences based off of my personal struggles with nicotine addiction. In the picture, you can see me standing before a podium. I had the honor to speak at a press conference in Washington, D.C., hosted by House Speaker Nancy Pelosi. I told my story about attending my first high school football game and being offered a Juul. I was told it was harmless and tasted like mint gum. I love mint gum, so I didn't see the danger in trying it. I would have never tried a combustible cigarette because I knew how harmful they were, and I was taught as a child how gross they were. I became addicted to a Juul and got caught at my school with mine and had to serve detention. I was scared and ashamed because I had never been in trouble before. I tried quitting unsuccessfully 3 to 4 times over the next several months and then finally did when my supply was cut off over the summer break. It is still hard at times when I am around friends who still use puff bars and other vaping products. At the press conference, we were able to sit in the gallery of the U.S. House of Representatives and witness our bill be debated and passed. I was so excited to see long hours of our advocacy efforts to end the way we wanted. You can see in this picture we were celebrating with our team from Tobacco-Free Kids in Washington, D.C. We have also been active in state-level advocacy. Last year I spoke at the Coalition for a Smoke-Free Tomorrow rally to advocate for Tobacco 21, increased funding for our prevention and cessation, as well as a new excise tax. We have all met with our state senator and representative to ask for their support, and just last Monday, Abigail Berman, who is with me today, spoke at a virtual news conference to help introduce new legislation being proposed to allow local governments more control regarding tobacco sales and advertising in their communities. The next picture is with all of us and our U.S. representative. Young people need to reach out to your congressman. Young people can use their voices. Our viewpoint is valuable and representatives do listen. I hope a lot more young people will speak up and advocate. Our efforts have gained a lot of attention. We have been featured in newspapers, television including Good Morning America, and promotional videos or commercials to be used in education efforts nationwide. While listening to this presentation, you may have thought, why did you not start locally with your efforts? Why did you go to your state and national leaders? Well, Kentucky city and county governments cannot enact tobacco control measures regarding the use, display, sale, and distribution of tobacco products under KRS 438.3000. We are asking legislators to repeal 1996 statutory language that preempts local governments from adopting how tobacco products are displayed, sold, distributed, and used. If this happens, we will be able to advocate to our local mayor and elected officials for change in our area. It will be a game changer for youth. Thank you for your kind attention today. To summarize, teach your teens that e-cigarettes are not harmless water vapor. They are addictive and dangerous. Pass stricter laws that keep tobacco and nicotine out of the hands of young people. Spread the message and advocate every chance you get. You may save someone's life.
Abby, that's amazing. Thank you so much for first sharing your experience, basically having the courage to tell your story, and then to use it to make a difference. I'm not sure every student out there is going to end up standing at the podium in the U.S. House of Representatives, but you didn't have that connection before, but because you were so strong and telling your story, it brought you to that level, and we're just very, really grateful. Our next speaker is Tammy Capoletti. Tammy has been a registered respiratory therapist and allied health educator for more than 30 years. She also has volunteered for the American Lung Association for 30 years and has been an employee of the Lung Association for the past 8, working in health promotions and education for all things lung disease and tobacco. She's going to talk to us about how to talk to your kids about vaping and tobacco use. Tammy?
Hi there. Yeah, I am here to speak to you about some of our resources and how to speak to your kids about vaping, how to get that conversation started. As the scope of the youth vaping epidemic expands, the American Lung Association has recognized the need to act quickly to provide a coordinated response that leverages the full strength of our organization. Our initiative in the epidemic encompasses education, advocacy, and research, and it has 4 components. I'm here to talk about the first 2 with our campaign with an ad council. It's a public awareness campaign to equip parents with the facts about e-cigarettes and support conversations before kids ever start to vape. The Vapefree Schools initiative to help educators address the surge of youth vaping. On this slide, you can see why our efforts are so urgent. The youth vaping rates have dramatically increased in the last 2 years, and even though a growing number of youth are vaping, most parents don't think their kids are using. And because many parents assume that their kids aren't affected, they're not proactive in their conversations with their children about the dangers and then preventing them from starting at all. So we have a new vaping awareness campaign. It's a few months old. Get your head out of the clouds. The purpose of the campaign is to serve as a wake-up call to parents of the ages 10 to 14, give them the facts about the dangers of vaping, and help break down the barriers so they can have ongoing, effective conversations with their children while they're still willing to listen. We found that this is the age group that still actually will sit down and listen to their parents. By reaching parents of this age group, we will help them prevent their kids from starting and help the parents start the dialogue. So going to the website talkaboutvaping.org is a great way to start, talkaboutvaping.org. Another way to get there is through our www.lung.org website, or you can even just Google the Vape Talk, and it will get you to this page here. So, but I do encourage you to go to www.lung.org anytime and really dig through, because you'll see that, you know, this is just one page of many, many that we do have to help just get some more education and facts before you get started talking to your kids. So when you click here on Get the Facts, you can get fact sheets either printed or you can send them to your email. And the fact sheets have many, many things, but it includes what is vaping, what is the attraction to the flavors, is it actually water vapor? No, it is not. The signs of use, what does it look like when your kid might be vaping? What do the devices look like? There are a lot of devices, and you know, even with me sitting in the position I am, they will fool me. There are so many things out there that are easy to get past parents and teachers. Addiction and nicotine, why are the kids doing it? And all about big tobacco. Big tobacco is really to blame here. It's their whole reason is to pull in that new customer. So we give you a lot of information about big tobacco before you get started talking to your kids. You click the conversation guide or the personalized guide, and you will get your ideas on how to start that conversation. When you do the personalized part, it just gives you a few quiz questions that kind of assess what your knowledge is already and the age group that you're speaking to. Then you'll come to the Get Talking, and again, you can email this to yourself or you can just print the guide out so that you're prepared. But it talks about what to do before you start talking to your kid. Know the facts. Put yourself in that child's shoes. Their obstacles, the pressures they're under, the social environment. It's very different than when I was a child. The better the communication, the less risks that kids will take if they're comfortable with their parents. And then while you talk, you're going to acknowledge the child's independence, ask for their perspectives because you want to hear their side of the story. Be ready to hear that they have vaped. Don't, take it for granted that, oh, my kid could not have done that. Be ready to hear that they've at least tried it so that you don't react. Blame big tobacco and not your kid. And it is big tobacco that should be blamed. And avoid scare tactics. And then there's another session on after you talk, so that you're prepared to, show your appreciation for their honesty and thank them for sitting down and taking time with you, and help them to manage their stress. And it gives you examples of healthy outlets to manage stress for kids, help them to manage their peer pressures. There's even rehearsals and role plays so that you can help them be prepared for conversations with their peers that might be hard ones. Moving on to schools, there's a Vape-Free Schools initiative. And through that initiative, the American Lung Association helps schools navigate this public health emergency with tools to protect and support both schools and students. Being recognized as a member of the ALA Vape-Free Schools Initiative means that your school is a leader in supporting students affected by e-cigarettes, offering clear guidance, education, and cessation, and it gives a toolkit of resources that helps you share your efforts with students, parents, staff, and the whole community. This is what that will look like when you try to navigate through the website. You'll find Vape-Free Schools Initiative. You can just sign up and get started. You can also take a quiz, and the quiz will show you how your school's current policy scores in lowering teen tobacco use. So you can find out what changes might need to be tweaked. These are the components of the Vape-Free Schools Initiative, and I'll quickly walk through all three components. The in-depth is our alternative to suspension. So many times, and I believe Abby even talked about this, that kids that get caught with tobacco paraphernalia are suspended. And we found out that that's not the answer. On suspension, you can just sit home and vape. So we have an alternative to suspension, an in-depth program. It's facilitated by trained adults. It's 4 50-minute sessions for the kids that get caught with tobacco. They're sent into this in-depth program instead of being suspended. The goal of the program is to educate the students about nicotine dependence and cravings and guide them through the process of identifying their reasons, why they choose, smoke, vape, whatever their tobacco use is. And we did find out that the kids that came through the in-depth program, 60% of them reported that they were either willing to decrease their tobacco use or quit completely and go on to a cessation program. This is our cessation program, not on tobacco, and it's our second component. It takes a holistic approach with each session using a variety of different learning strategies based on social cognitive theory of behavior change. It can be applied and practiced in everyday life. NOT encourages the pathway for ages 14 to 19 as they begin their quit journey. NOT is taught by a trained facilitator. So most likely one of you in the audience would become a facilitator. Then you would gather a small group format, like 6 to 10 participants who are ready to quit, and this will help improve their life skills like stress management, communication, and decision making. And I want to let you guys be the first to hear we have an up and coming app. We're working with Kendia Labs and Prepped Health, PHMC, and Dr. Kimberly Horn to update NOT so that we can offer it as a self-guided student app. And possible for release for that will be spring of 21. So you're the first to hear. I'm pretty excited about that. And then the Vape-Free School Policy is the next component. It recognizes that tobacco use, including e-cigarettes, is a health, safety, and environmental hazard in schools. Through this brief school policy assessment, schools can review and improve their policies and provide clear guidance to students and employees and visitors and address tobacco use in schools in a comprehensive way and a consistent way. The Vape-Free Schools Initiative Toolkit for Schools. So to be a member of the initiative, one or more of the school personnel will complete each one of the 3 trainings I just talked about. Being a member of the Vape-Free Schools Initiative means that these schools are leaders in supporting students impacted by tobacco use, including e-cigarettes. And you'll have a toolkit then to download with resources that the Lung Association can help with addressing the youth epidemic, vaping epidemic. Now I want to show you that we also want to share with you other programs. We don't just toot our own horn, so to speak. There's lots of educational programs out there, and we do list them on our website. There are probably 30 plus other places that you can review. We just want you to know the best and most reliable, so you can educate yourself before starting to talk to your kids. So there are plenty out there. 3 of my favorites are the Stanford University Tobacco Cessation Toolkit. The curriculum is basically done for any teachers that would want to institute that program. The Truth Initiative, this is quitting. My Life, My Quit is by the National Jewish Health System, all good. Again, all these resources and cessation programs are listed on our website as well. When you get into our website and start looking at our courses, you'll see lots and lots of courses. But to get to the 3 that I just talked about, you'll go over to the far right on tobacco, and listed will be in-depth and not, and the school policies. And then also one that I would encourage everyone to do is tobacco basics. It's about 45 minutes. There's 5 short modules to go through, and it is just what it says. It is the basics about tobacco that we should all have in our knowledge bank before we start talking to our kids about it. And here's just more. There's a toolkit for providers to end the e-cigarette epidemic, resources for parents, teachers, and providers, and also resources for youth in our toolkit. And it talks about things like what can states do to reduce e-cigarette use, what parents need to know, what schools should know, how can I tell if my child is juuling, etc. So there's lots in the toolkit. And then I just want to mention before I stop talking is that we do have for the older group, colleges and universities, we do have a toolkit for tobacco-free campuses and how to start tobacco-free campus. And this is how you can get a hold of me for any questions or further information.
Tammy, I've always admired your work and I'm grateful for the tips that you shared, the materials that the Lung Association has put together, and I think that this will help me as I speak with teens and young adults in my own work. So thank you so much.
Thank you.
You're welcome. Thank you. Next, we're going to switch to other substances, in particular opioids and prescription drugs. Our speaker coming up is Van Ingram, Executive Director for the Kentucky Office of Drug Control Policy, which coordinates Kentucky's substance use efforts in enforcement, treatment, and prevention and education. Van served with the Maysville, Kentucky Police Department for more than 23 years, the last 6 as Chief of Police, and he was named Kentucky Chief of the Year in 2001. He also is a former recipient of the Governor's Award for Outstanding Contribution to Law Enforcement, as well as the Melvin Shine Award for Distinguished Service. I know that he's a great resource for the Foundation of Healthy Kentucky as well. Van, please go ahead.
Thank you, Bonnie, and appreciate you. And really appreciate the work of the Foundation for Healthy Kentucky. We can always count on them for their leadership, for their great surveys that they do, and, of course, the Bost Forum. During this pandemic, the epidemic that we were in, of substance use disorder has only worsened, as you can imagine. 2020 will be by far our worst year for fatal drug overdoses. In May, we set a record with nearly 250 deaths. It's just been a horrible year for overdoses in general and in overdose deaths as well. The good news is the EMS, we get pretty timely data from emergency services. And we've noticed that opioid response runs are trending down significantly, and in December reached pre-pandemic levels. So that's a good sign, and one we're taking some hope from. A big part of this epidemic has been this increase can be attributed to fentanyl. A lot of fentanyl in the drug supply. Very little heroin anymore. It's almost all fentanyl. And then an increase in psychostimulants with methamphetamine and cocaine that often both contain fentanyl themselves. And then, of course, the another troubling aspect of fentanyl is being disguised as legitimate pharmaceuticals. Percocet 30s, Xanax bars, they're made to look like these drugs, but actually the active ingredient is fentanyl. So all these things are driving the trends. But it's not been all bad. In the pandemic, we've learned a lot about virtual counseling, virtual meetings. We've learned a lot about, we've suspended prior authorizations for substance use disorder, which has been good. So we've learned some things. Transportation's always been such a big issue in Kentucky. People making it to a treatment appointment, to a counseling appointment. And we've learned a lot about doing that virtually throughout this pandemic. And I think that will stick around for a while. Our 8338KY Help is our statewide call center. Numbers have risen to the call center throughout the pandemic. That's both calls in and then we call back out. Operation Unite runs that program for us. We feel the need now to expand the hours of the program into the evening and on weekends, and we'll be doing that very soon. Now, many of you are aware of the Kentucky Opioid Response Effort, or CORE as we call it, that is housed in the Division of Behavioral Health with Commissioner Wendy Morris. And she's put together a tremendous team that has worked on a number of projects and continued to work throughout this pandemic. The Treatment Access Program, to make sure that anybody who qualifies for residential treatment is not turned away from an inability to pay, as well as allows us to expand that program and get folks to stay a longer period of time than maybe they otherwise would have had the opportunity to. CORE has also stood up quick response teams all across the state, and we're getting wonderful reports back from those QRTs about folks being willing to enter into treatment and willing to have those conversations after a non-fatal overdose. We started a program called the Strategic Initiative for Transformational Employment, or SITE, which locates in all of our career centers around the state someone whose sole job is to focus on getting people in recovery into meaningful jobs. That program is funded by CORE and my office, and we're very, very proud of it. We've also, within the Department of Corrections, established hiring specialists to work with people coming out of our prisons and jails to link them with jobs. That has also been extremely successful. We've worked on things like Oxford House and other transitional housing opportunities. We've come to realize that housing and employment are so important early in people's recovery, and we've got to do all we can to help people stay in recovery. CORE has allowed us to get back in our schools in a meaningful way. With Too Good for Drugs is a evidence-based program. It's been around a long time. It is proven factually to be effective, and it's now in 240 schools, serving over 42,000 students, and we're really excited about that. Also, another great program, Sources of Strength, now in over 100 schools, and trained many folks on that program. It also is evidence-based and an exciting program to get back in our schools. And they've been able to do that even throughout the pandemic and the virtual learning. They've been able to record the lessons and then make them available for at-home learning or distance learning. And so we've been able to carry on with these programs even throughout the pandemic. My office has also entered into a project with the Kentucky Chamber Foundation. We've got folks that are hired and trained to go out and encourage and teach employers about being a second chance employer. There's a critical shortage of labor in our workforce. There's lots of individual companies and businesses that need employees, and we believe folks in recovery can be very, very good employees, very loyal and dedicated employees, and we're trying to get that message out as much as we can. The Kentucky State Police Angel Program continues its work with hundreds of folks that have come to the State Police Post wanting to access treatment, and KSP has been able to make that linkage and make that happen. Finally, one of the most important things we've done throughout this pandemic is increase the access to the naloxone. Tens of thousands of doses have been distributed through our syringe exchange programs, through community events. My office has purchased hundreds of naloxone kits for law enforcement all across the state. We're getting really good reports back from law enforcement about saving people's lives with the naloxone. So we're going to continue that effort. It's so important with fentanyl and all throughout our illicit drug supply that we have easy access to this life-saving drug, naloxone. I could go on. That's just kind of the highlights of what the state is doing. There are many, many other projects that are going on throughout the cabinets. I will tell you about a bill that is sponsored by Representative Bowling. It's to certify communities as recovery ready. You may have heard of communities being designated as work ready. Well, we want our communities to be recovery ready. We want our communities to take a look and take stock of what they have for people in recovery, and more importantly, what they don't have, and be able to take stock of what resources are available and what resources are needed, and figure out how to make that happen. So we're excited about the prospect of that becoming law. And with that, I'll turn it back to you, Bonnie.
Wow, that is a lot of different programs, and it gives me hope that we are really looking to ways to help persons who are dealing with drug addiction, the tools that they need to get back and to enjoy their lives and be productive citizens and be able to overcome and address that addiction. Thank you so much. As I said, we look to your office quite a bit for data as well as solutions. Our final speaker today is Divine Karama. He is a socially conscious hip-hop artist. He's an educator, he's a community activist, and he's also a motivational youth speaker, and he hails from Lexington. Divine is the director of a Kentucky-based nonprofit for youth called Believing in Forever, Inc. His initiatives under that umbrella are many. They include a coat to keep the cold away. It's a youth coat drive, Dads on Campus at Kentucky State University, Sons of Single Mothers Mentoring Days, and many others. In 2020, in honor of his late daughter, Camaria Spalding, Divine started the Luna Library to provide free books focused on Black history and characters to children in the Lexington area. In another endeavor called Kentucky LLC, he hosts local artistic events. And if that's not enough, Divine is also the community outreach coordinator for the FEND movement, which combines cutting-edge technology, music, and streetwear to empower kids to beat the opioid crisis. I have looked forward to this presentation, Divine, for several weeks, and I welcome you to go ahead.
Hello, good afternoon, everybody. First and foremost, I'm just thankful for the opportunity. Loved hearing Tammy and Van and Abby's presentation. I've learned a lot that I think is going to be able to help me in my work, and has definitely, motivated me with my presentation. So, as Bonnie mentioned, I am a hip-hop artist and a community youth activist. So a lot of my work is preventative, and I want to come from maybe a different perspective than the other presenters, with knowledge from being on the front lines of working with young people every day. I think one of the most challenging things that young people are faced with is probably social media and music. For the last couple of years, hip-hop has been the most streamed genre of music in the world. Its cultural impact is exacerbated by platforms like TikTok, I'm sure we've all seen, and Instagram, have largely influenced TV commercials, professional sports industries, movies, and even other genres of music. And the majority of these streaming numbers are coming from young people under the age of 25. And being somebody that grew up and is a part of hip-hop music, it bothers me that so much of the content coming from hip-hop, at least mainstream hip-hop today, almost glorifies substance use. And to provide a little context, for those that don't know much about hip-hop culture, a lot of it is founded in messaging coming from oppressed and marginalized sectors of our country. Therefore, a lot of the content that you hear is not going to be pretty. The conditions that many of these communities are in leave young people more susceptible to substance abuse. And I'm of the belief that if you want to change the content in the music, you have to heal the wounds in the communities in which the music is coming from. But with that said, we're in this social media age, so it's less about the popular athlete in school or the cool kid with the nice car that are pressuring our young people to do things. Now it's some of the most recognizable faces in the world that can be accessed from our phones that are pushing our kids to do a lot of these things. So I work a lot with using hip-hop in a positive way to engage youth, to let them know that, even though a lot of what they're getting from mainstream hip-hop is negative, we can flip that and we can use this beautiful art form and culture to bring forth positivity. Another thing I noticed in my work is the legal fight and almost glorification of marijuana, which can be confusing and even embolden drug use to young people who don't have the proper context. For adults, we understand the difference between medical and recreational use, the difference in the impact recreational use can have on adults and young people. But unfortunately, we often frame that discussion around smoking weed, and the promotion of this idea very vaguely without much educational context. So to a 12 or 13-year-old boy who may already be experimenting with drugs, all of this legalized marijuana talk just sounds like a wave of encouragement, and that it's okay to take illegal drugs. So I think that we got to be careful in our behavior, and we got to be more accountable to the language that we use when we're talking about that fight around young people, because I think it's confusing them because they don't have the proper context. And I know we're short on time, so I'll close with this point, which is the biggest, at least in my industry, in the true gateway to substance abuse for young people, and that's trauma, depression, and mental health. Many of the youth that I serve live in, conditions such as poverty, broken homes, experience extreme violence, abuse, untreated mental health issues, family members incarcerated, and then you add on top of that the marginalization and systematic oppression coupled with a global pandemic and the social unrest. This deep-seated and often untreated trauma pushes many young people towards anything that can give them a temporary reprieve or even expedition to some type of value. And, vaping, smoking, drinking, engaging in risky behavior also provides them content for social media that in this, generation can make them cool while also providing some type of release. So without a solid infrastructure, many of these kids are on a fast track towards addiction. I've seen it time and time again. I always tell people that trauma is the true gateway to extensive drug use. So that is why I've dedicated my life to mentoring, community collaborations, resources, activities, and other forms of youth engagement, because I know how crucial and critical that is, especially to our young people that don't have a solid family infrastructure and need an alternative. And I'll close just shouting out the FIN movement, which was mentioned earlier, which is a phone app that incentivizes young people learning about the negative impacts of opioid use and promoting that knowledge amongst their peer groups. So hopefully I provided maybe a little bit different take. I've learned a lot today. I am more emboldened and motivated in my work and look forward to answering any questions that are out there. Thank you.
Thank you so much, Divine. I know that 2020 was a particularly rough year for you, and I admire your fortitude, both for the work that you've been doing, but also the work that you added in honor of your daughter to help reach out to young people. How does someone get the FEND program? Is it an app? How do they download it? How do they get a hold of that?
Sure. So I think right now they're actually revamping the app. It is still active, but I think they're going to be adding some new content. But if they go to just their Apple Store or their App Store on their phone, they can download the Fin Movement. It is a black icon with white lettering, and they just sign up. And then they take that opening quiz. And as they continue to go through the content, they can win different, gifts, gift cards, and obviously, with the pandemic, we were giving away concert tickets and doing some pretty cool things. So we're adjusting the incentives on our end, but it's that simple. It is a free app, and we have over 1,000 Lexington youth that have downloaded the app already. So it's making a difference.
That's wonderful. It is time for Q&A, and I do have a question that I would like to address to both Van Ingram and to Divine. But first, I wanted to mention that the bill number that Van Ingram referenced, Representative Bowling's bill to certify communities as recovery ready, is House Bill 7. So if you're interested in supporting that, it sounds like a good bill. I haven't taken a look at it myself. It is House Bill 7. Van, do you have any data on the OD and death numbers for youth since COVID-19? And does the department also have some resources that are targeted specifically for youth, or where would you point people to address those issues?
Yeah, each of our regional prevention centers have programs aimed at youth. I think Kathy Prothwell is on this call. I would suggest Kathy is a great resource to guide you to what's out there. As far as overdose death numbers among youth, I haven't seen much change throughout the pandemic. Our largest demographic continues to be 35 to 44, and then 45 to 54. But they're it's always something we're looking at, but it doesn't seem to be a significant change in the numbers of youth suffering overdose during the pandemic.
Okay. Divine, what's been your experience with youth illicit drug use during the pandemic? Just your personal experience with the teens you work with. Have you seen an increase, decrease?
Yes. I saw an increase at the very beginning. It was actually really bad at the very beginning, because it wasn't just that, kids couldn't go to school, but a lot of the programs that I facilitate and other community partners facilitate that are before and after school programs and even on the weekend, those were kind of stifled because of the social distancing guidelines and spaces being shut down. I agree with Van. It's gotten a little bit better towards the end of the year, going into the new year. But violence is another thing that was on the uptick with the youth that I serve as well. And some of that can be attributed to some of the drug use. So I saw a huge increase early. We're seeing signs of it getting a little bit better. So I can't wait to get back to work so we can continue those trends of getting back to where we were pre-pandemic.
Okay. So as we're looking at youth and, of course, the mental health issues that go along with the trauma that often result in the drug use, do you think schools are an appropriate place to provide the mental health lessons or even direct individual care to youth? Are schools the right venue, in your opinion?
I think so. Obviously, I'm always going to go with community partners. I think sometimes too much pressure and stress is put on the parents and on the school, but I think that three-pronged, resource, to make sure students got everything they need is the community. So I would like to see more community agencies and partnerships, but I do believe school is a good place, a great start. I know that there's an initiative going on right now, to get more mental health professionals in the schools. So our kids are there most of their waking moments during the day, during the week. So I do think it's important to have that resource at our schools.
Great. And Van, you mentioned in particular at least one, if not two, programs that are in some Kentucky schools. What were the names of those programs again, please?
Too Good for Drugs, which is currently in 240 schools, and Sources of Strength, which is not necessarily a drug program, but it has lessons that translate very well into substance use. So they're both really, really fine programs.
Good. Too Good for Drugs and Sources of Strength. Let's move back to tobacco for a minute then. A couple people have asked, how do you think the pandemic has impacted youth tobacco usage, youth vaping? And I'd really like to address this specifically to Abby and her schoolmates who are with her. Are your friends or people that you're hearing about among your peer group vaping more during the pandemic, or do they have less access and more parental oversight, so there's less? Abby?
My fellow panel member, Natalie Herring, is going to answer this question.
I think that the pandemic has caused students to vape more because they have nothing to do at home, so they're turning to vaping as the answer.
That's a little bit scary. Another person asked, and any one of the students on the panel can answer this, please. What really works to help kids stop vaping then? Abby, you mentioned that you had to be completely cut off from your source and that you had gotten in trouble. So if you all could, a couple of you could address what works.
Banning the flavors in e-cigarettes. No teenager wants a tobacco-flavored Juul pod or e-cigarette juice, and having a candy-flavored product that creates a buzz-like feeling without the actual tobacco taste, that definitely draws kids in, and they're bright-colored, and they're just really appealing, more so than the tobacco flavors. And so I think banning the flavors in e-cigarettes would definitely cause a decrease in the attraction to them.
Well, and what we learned is when the FDA did a partial ban on flavored, they ended up only banning products that were in cartridges sold separately, but the self-contained disposable e-cigarette market just blew up after that partial ban went into effect, and now you can still find tons of flavored products on the market, can't you?
Yes.
Where do you see those in your community, Abby? Where do kids see those?
In gas stations, they're usually advertised at the front. They're definitely they're more advertised than the regular tobacco products because I guess they're more appealing to teenagers. And social media is a big hit for those.
Okay, thank you. Got a question here for you, Van, again on Kratom. Where does that fit with youth these days, and how does that fit into the Office of Drug Control Policies programs?
Yeah, Kratom is actually a legal substance. We tried to run a couple of bills here in Kentucky a couple of different times to ban it here when we're unsuccessful. And then the DEA put it on as a drug of great concern that they were planning to schedule and then withdrew. Statewide, it's not a huge issue, but what it does do is it kind of takes off as a fad in local communities. You'll see it get real popular in a community for a while and then kind of run its course. And we see it pop up around the state from place to place. I'm told that a small amount of use produces kind of a stimulant effect, where heavier use produces more of a depressant effect. So I don't know the future of Kratom. I'd like for DEA to take it back up and take another look at it and do more research on it. But it's going to be hard for us to ban it in Kentucky as long as DEA does not have it banned as well.
For those of us who aren't familiar with it, what does it look like? How is it sold? How do people find it?
Can be sold as a liquid, can be sold as a plant-based material. That's the way you usually see it. But I've seen it in liquid form as well.
Okay. All right. Going back to tobacco a minute, and also to the question about the local tobacco control bill, we were asked if there is any state that does allow city and county officials to implement policies regarding the use, distribution, sale, or marketing of tobacco products? And I can answer that one. And the answer is yes, some states do. The Kentucky law was passed in 1996 at the behest of Big Tobacco, which really went state by state and tried to get state legislatures to adopt this language that said local communities can't pass these kinds of ordinances governing tobacco marketing sales in their local communities. And in doing that, they overturned some existing local laws and then preempted new ones. And that's why there's an effort to get rid of that language after 24 years in Kentucky. But some states do, and you may remember that, for instance, there are some cities in California that have banned flavored e-cigarettes. And so they have the right to do that. And the question was, is health improved in those states? I don't have the answer to that right away, but what I do know is that there are many evidence-based measures that cities and counties can adopt that in fact do result in better health, lower tobacco use, and reduced costs associated with the health care and liability of tobacco use. Abby or any of your teammates, did you want to say anything else about the local tobacco control bill?
It'll definitely be a game changer. I think you covered a lot on that topic. I think there are only 5 states right now that are offering local laws, and that's Massachusetts, New Jersey, New York, Rhode Island, and California. And these laws haven't been in effect too long to see long-term results, but I think it'll definitely be a big game changer.
Great. The bills in the Kentucky legislature, by the way, are Senate Bill 81 and House Bill 147. Those were both filed last week, and we hope that they will move forward. So please do encourage your lawmakers to move those forward. Tammy, a couple of questions for you. Are the in-depth and not on tobacco programs video, or are they just materials that need to be taught by a live local person?
Well, the training itself, in-depth, is always online, and it's real quick. Not is typically in person for training, and I want to get back to that quickly, but right now it has been switched to virtual. And then as far as the schools or the facilitators that are using them, we are just suggesting that whatever platform they're using for, their e-learning, to go ahead and utilize that.
Okay, and can you give a quick instruction quickly where you find that on the website? It's lung.org/what?
Yeah, it's just www.lung.org, and then along the top you'll find quit smoking, and you can find a lot of topics under quit smoking. Or if you want to actually look at our not and in-depth trainings, just go to Get Involved, and underneath that it'll say Become a Facilitator or an Educator.
Okay. Let's see. We do have a comment that we believe that the COVID pandemic has caused an increase in mental health emergencies among adults, but as well as among youth. And of course, we addressed some of those issues in the most recent webinar preceding this one, which you can find on the Foundation website at www.healthy-ky.org/events. Just look under the Bost Forum, and all of the webinars in this series are recorded, and the presentations are available there on that website. But did anyone want to comment, perhaps Abby, on the mental health issues that you all are seeing among your peers? Are you seeing that kids are having trouble more, and that's causing more vaping, and are they getting access to the resources they need with schools closed?
I'm not exactly sure how the mental health has been affecting students more recently. I definitely think it's a lot harder on students now, just being isolated at home, whatever their at-home situation may look like. But thankfully, mental health access has been a lot easier to get during the pandemic through online virtual meetings, so I think that's definitely helped. But I do believe it's harder on students right now.
Okay, and Van did talk about the telehealth. One last question before we close, and this one's for Tammy. How do you get a permission to use the Get Your Head Out of the Clouds campaign messaging on social media campaigns? There's a health department that has some funding to use Twitter, Snapchat, and Facebook, and they would love to use some of your logos and graphics. Is that possible?
It is possible, and that is not my area of expertise, but I've got Gary's email written down so that I can get back to him on the answer to that. We've got people for that.
Wonderful. Well, that's all the time that we have for live questions today, but please remember, if you asked a question that wasn't answered, we'll be responding to you in the days ahead. And this webinar will be posted, the recording of it, at www.healthy-ky.org. You can see the link there on your screen later this week, as well as the two presentations that we had. Please share this link with your networks. Not everybody could be online today, but we do this recording so that other people can take a look and learn some of the great information that we got from our presenters today. You can also find a list of upcoming webinars and events that the Foundation is hosting. I want to say a special thank you to all of our speakers today, Tammy, Divine, Van, Abby, and Abby's schoolmates. Thank you so much for sharing your thoughts, your experience, your expertise, and the solutions to some of the issues that Kentucky youth are facing with tobacco and other substance use. Appreciate the time of our audience as well and your willingness to advocate and to be aware on behalf of the youth in the Commonwealth. Thank you so much for joining us and have a wonderful day. Take care. Bye-bye.